Good afternoon. This is my presentation on sleep disorders. Introduction. What are sleep disorders? They involve problems with the quality, timing, and amount of sleep, which result in daytime distress and impairment in functioning. The most common sleep-wake disorder is insomnia. Sleep difficulties are linked to emotional and physical problems. About 1/3 of adults report insomnia symptoms, and 6 to 10% meet the criteria for insomnia disorder. Introduction continued. There are many different types of sleep disorders. The International Classification of Sleep Disorders, ICSD, helps provide a standardized classification system and definition of sleep disorders. Insomnia, sleep-disordered breathing, central disorders of hypersomnolence, circadian rhythm, sleep-wake disorders, parasomnias, and sleep-related movement disorders. Introduction continued. Clinical presentations of sleep disorders depend on the specific disease. Early identification of the underlying sleep disorder is essential to prevent complications and health consequences. Common signs and symptoms. Late sleep onset and wake-up time, delayed sleep phase syndrome. Difficulty initiating sleep or maintaining sleep, daytime sleepiness with the inability to nap, insomnia. Excessive daytime sleepiness, cataplexy, hallucinations upon falling asleep or awakening, narcolepsy. Snoring, witnessed apneas, gasping or choking, excessive daytime sleepiness is considered obstructive sleep apnea. Uncomfortable sensation in both legs is restless leg syndrome. These are the most common symptoms of the most common disorders. Therapies. There is cognitive behavioral therapy, and hypnotic medications are treatment options for insomnia. The therapy focuses on changing false beliefs and attitudes about sleep, in addition to providing sleep hygiene education. Therapies continued. Hygiene education includes keeping pets out of the bedroom, avoiding caffeine consumption after 4 p.m., and maintaining a cool and conducive sleep environment, avoiding watching the clock, and refraining from exercising within 2 to 3 hours before bedtime. Stimulus control. Go to bed only when sleepy, use the bedroom for only sleep and sex, go to another room if unable to fall asleep within 15 to 20 minutes, and engage in other activities that are quiet. Associations with other disorders. A large number of mental, neurological, and other medical disorders are associated with disturbances of sleep and wakefulness. The neurological disorders that are commonly associated with sleep disturbances are degenerative disorders such as epilepsy and headaches. The assessment instrument. The only well-known and well-studied global instrument presently in use is the Pittsburgh Sleep Quality Index. This instrument, although the first of its kind and helpful in quantifying the severity of global sleep disturbance, was not intended to be used as a standalone screening tool by non-sleep professionals. Patients complete this instrument and provide the clinician with an easy way to discern between the various sleep disorders. The current research indicates that sleep disturbances may be linked explicitly to suicidal behaviors. It remains unclear, however, whether this link is primarily explained by depressive symptoms. Pediatric sleep disorders. Current evidence suggests that chronically disrupted sleep in children and adolescents can lead to problems in cognitive functioning. Behavioral interventions for pediatric sleep problems in young children have been shown to produce clinically significant improvements. What are the treatment approaches for sleep disorder in teens? Cognitive behavioral therapy for insomnia and stimulus control therapy is under the category of psychotherapy. Mind and body practices such as yoga, tai chi, mindfulness meditation, healthy lifestyle adjustments, regular sleep schedule, exercise, healthy diet, optimized sleep environment, and melatonin supplements, and prescription medications. Geriatric sleep disorders. Compared with younger people, elderly people show age-related sleep changes, including an advanced sleep phase and decreased slow-wave sleep, which results in fragmented sleep and early awakening. In elderly individuals, sleep maintenance insomnia and early awakening are more common complaints than sleep onset insomnia. These are two charts about sleep and aging. Reasons for sleepiness in the elderly are insomnia, medication, worry, stress, or grief, lack of physical activity, and underlying diseases or conditions. Prevention and management. 5 ways to improve your sleep. Avoid caffeine. Do not nap during the day. Avoid screen time in bed. Try to stick to a routine and make your bedroom quiet and dark. Something that I actually do before I go to bed is I read a chapter, and usually that helps me sleep like within 20 minutes, which is apparently the recommended time you're supposed to fall asleep within, just 20 minutes of getting into bed. So that's something that I've done, and I think that helps. The future research that people are rooting for is that sleep is the fundamental pillar of public health, and the public health initiatives can enhance the well-being of individuals and communities, as well as ameliorate health disparities among racial and ethnic minority groups. Policymakers can make the start of school time later to promote healthier sleep patterns for teenagers, because teenagers like to go to sleep really late and wake up really late compared to everyone else. They just don't fall asleep for whatever reason. And adults fall asleep much quicker than teenagers because they know they have to get up and go to work. So I think that's a big change that should be implemented in the future research of, promoting better sleep, because sleep is very important. And that is the conclusion and all the references of my PowerPoint.